Child Health Investment Partnership, or CHIP, has recently rebranded themselves in order to fit their new mission and vision for the Roanoke Valley. They did this in celebration of their 30th anniversary. To commemorate 30 years, the nonprofit recently just conducted research on their work and are hosting a community conversation on their findings. Here to tell us about their findings is Haldeman, CEO of CHIP of the Roanoke Valley. Thank you so much for coming in.
Thank you for having me.
So you have a busy 2018 ahead.
We do.
And 30 years is amazing. Congratulations on that.
Thank you.
So
it's a huge accomplishment.
Yeah, so tell us about some of the initiatives that you have coming up for this year.
So we're really just launching a rebranding campaign.
Okay.
We have a new vision and a new mission statement. Our vision is that every child will have equal access to health equity and school readiness. So, you know, that's really what we're working towards and what we've been doing for the last 30 years.
Okay, so we mentioned it, but you conducted research, and what did you find?
Well, we're going to present some of that tomorrow in a community conversation, but what we're looking at is a lot of the inequities in health between children who come from very high-risk families versus children who do not.
Okay.
And what CHIP is doing to bridge the gap between those health inequities, and then looking at their school performance once they reach school to see how we can do better to level the playing field for children who do have more risk factors than they do protective factors.
Right, so doing this research can absolutely have an effect on the future.
Absolutely, it will. Yes.
So let's talk about the community conversation that you are having tomorrow.
Okay.
It is open to the public, is that right?
If people are interested in coming, I'd love to have them. We've almost got a full house now, but if it's something that really piques your interest, I'd love to have anybody come, because it is a conversation with the community.
Yeah, so what can people expect?
So Dr. Molly Odell, who is our past health director and just retired, she was the health director for New River Valley, is going to present with me. We're looking at some disparities in health and how we can bridge the gap and how we are bridging the gap. The importance of not having those health inequities, and then how they affect children once they reach school. And then we're going to be talking about what we can do as a community. So I'm hoping to have folks from the school system, from the health system, from city council there to talk about how we can come together to better support these children so that we don't see disparities once they reach school. Right.
And then, you know, there's been recent news on the Child Health Investment Partnership. Have you all been affected by that?
We are different. So we are Child Health Investment Partnership, not Child Health Insurance Program.
Okay.
So the federal insurance is CHIP, S-CHIP. And so we have been getting a lot of calls and confusion.
To make sure,
Yes.
Not the same thing.
Not the same thing. So
separate things.
It is very separate. So part of our rebranding campaign is to stop calling ourselves CHIP and start calling ourselves Child Health Investment Partnership.
Got it.
Because that's who we are.
Yes. So if somebody wants to find out more information on Child Health Investment Partnership, how can they do that?
They can go to our website. It's a brand new website as part of our rebranding, www.chiprv.org. Or come to our community conversation tomorrow and learn more about us, 8:30 to 10:30.